Are you still struggling to recover after your prostate surgery? If you are a man who's had either prostate surgery for an enlarged prostate, or you've had your prostate removed because of prostate cancer, you really should watch this, and I want you to watch it to the end because it gives you some important information that really isn't talked about a lot of other places. We are going to talk about the 4 P's: prostate, peeing, pelvic floor, and yes, penis. How are those connected with each other, and why does that matter so much for your recovery? Today, I am joined by my I Heart Guts friends, Pierre the prostate and Bradley the bladder, and they're going to help me teach you a little bit about your anatomy. We're going to talk about 5 things in this video that really will help you jumpstart your recovery and make it even better. The first one is, what is the prostate? Where is it exactly? Second, we'll explain exactly why you are leaking after you've had your prostate surgery. Third, we'll talk about why the pelvic floor muscles are so important for your recovery. Fourth, we're going to take a look beyond the pelvic floor so that you can see some other connections to the rest of the body that really are key to having the best recovery ever. First thing, prostate. You might have seen a few diagrams here and there, but it really does help to see this on a 3D model. If you look in here, you'll see the top of the bladder, which is right here. Now, I am going to remove that from the body so you can get a side view of how the bladder and the prostate are related. Here's the bladder and the prostate underneath. Next to it is the colon and the rectum. The bladder sits right on top of the prostate. So the prostate kind of acts like a main supporting beam to physically support the bladder. We're going to split this in half. I want you to look at this from the inside. You have the bladder itself, which has a muscle in it that squeezes out the urine. And then, if you see this little tube here, this is called the bladder neck, and that's going to be important. There is a valve here called the internal sphincter. That's one of the 2 valves that stays closed when you want to keep urine in the bladder and that opens up when you want to release urine. Then you have the urethra, which goes right through the prostate, kind of like the core of an apple. At the end here, you have another sphincter, which is part of the pelvic floor. That is called the external urethral sphincter, and again, it works with the internal one, a 2-valve system on either end of a support structure. If you've had surgery for an enlarged prostate rather than prostate removal, this is something really important to know. Often, the tissues here of the prostate will become enlarged. And as they grow, they kind of squeeze on that urethra, kind of like getting a kink in a garden hose or stepping on a garden hose. When you turn the faucet on, there's not going to be a lot of water coming out because there is an obstruction there or a restriction. The same thing happens if the prostate enlarges too much and encroaches upon the urethra. And so that's why they need to do prostate surgery at times to relieve that problem. Those 3 organs that you just saw, bladder, prostate, colon, all rest on a floor of muscle called the pelvic floor, if you can see that. Now, the pelvic floor is pretty amazing. It's composed of over 20 muscles in 3 different layers. So it's not just one muscle. Your pelvic floor muscles have 4 very important functions. The first one is support. These pelvic floor muscles, if you see them, they do look like a floor. They help support organs like your colon, your prostate, and your bladder. Your pelvic floor muscles also work as a stabilizer. They help to stabilize the pelvis and the spine so that your arms and legs can move and carry load and lift and do what they need to do. Third function is, we'll call it sphincter. Your sphincters are part of the pelvic floor. They are the muscles that will allow pee, poop, or gas to stay in when you want to keep it in and let it out when you want to let it out on your own terms. The fourth function is sexual. The pelvic floor muscles actually play a very important role, especially the ones here in the front, in both erection, ejaculation, and they are the ones responsible for a really nice orgasm. This is the deeper layer of the pelvic floor that you're seeing here. We call it layer 3. Layer 2 are those sphincters that I talked about. Remember the urethra sphincter that I mentioned that was the second valve? That's part of layer 2. And layer 1 is right here, right underneath the base of the penis and the scrotum. They hug kind of the inside of the pubic bones right here, and they attach to the sides of each sit bone. Now what's interesting to note is this muscle right here is right in front of the urethra. These muscles right here are literally called the legs of the penis. They actually help in sexual function like erection and ejaculation. They are made with different kinds of muscle fibers than the deeper layer 3 muscles that you saw that support the organs. So that's why they need to be retrained in a different way than just doing slow Kegels with long holds. As you can see from this side view, you have the bladder, you have the urethra that goes all the way through the prostate. Here's that sphincter I talked about, the external sphincter. That's part of that front pelvic floor. That's part of layer 2. Then you have the layer 1 muscles right there, and the urethra goes through, those layer 1 muscles goes through the area of the penis and all the way out the tip. Here's that layer 1 muscle that goes right in front of the urethra. So you can see a very strong connection between bladder, prostate, pelvic floor, and penis. They all are very interconnected. And here's why you're leaking after you have your prostate removed. When they remove the prostate, they usually also have to take this internal sphincter. The first valve goes away with the prostate. Now you have lost not only the prostate, which is your supporting structure for the bladder, but you've also lost one valve. So now your bladder has to rely only on that second valve, which is a pelvic floor muscle, to keep you dry. Now you're seeing the connection between why the pelvic floor is so important. That's why it's so important to get that pelvic floor super strong. After your prostate removal, your pelvic floor now has to assume a new identity and be the main thing that prevents you from leaking. And that is why your doctor often says to do Kegels after your surgery. Kegels are often not enough to get full recovery, and here's why. It's because of the connection between the pelvic floor, the pelvis itself, and the rest of the body. The pelvis connects the upper body to the lower body. And so we also need to consider structures above the pelvis and below the pelvis if we're going to get optimal healing. What structures would be so important above the pelvis? The main one that we really need to include in a recovery program is something that surprises most every guy. Do you know what it is? It's your diaphragm or your breathing muscle. There literally is a connection between the diaphragm and the pelvic floor. I go into this in a lot more detail in my video about the piston analogy, because the analogy is a lot like a piston. When one moves up, the other moves up. When one moves down, the other moves down. So if we pay no attention to how your diaphragm is moving when you breathe, we're really missing a big piece of the picture in your rehab. So considering your breath is very, very important, not only when you do your Kegels, but in other things that you do during your daily activities. And that's why we simply cannot ignore the breath and breathing mechanics as part of a comprehensive rehab program. Another important factor is the abdominals. Your abdominals are literally connected to your pelvic bones, and I'll show you right here. This is part of your abdominals. These are part of your abdominals as well. They go literally from your pelvic bone all the way up to your rib cage. And so we need to include your abdominals in your pelvic floor muscle retraining. Fun fact, did you know that your abdominals and your pelvic floor contract together? They're kind of like best buddies. So when one contracts, the other usually contracts as well. We can use that as a way to get your pelvic floor working better, faster. Those are two of the connections above. What about connections below the pelvis? Two other areas below your pelvic floor often get into trouble either before you've had prostate surgery or after, and those are the hips and the thighs, often the inside part of the thighs. Your glutes, your butt muscles, and your inner thighs will be tight. And that's something that's very surprising, how tight those muscles are. But if you really think about it, it makes perfect sense. If you have an enlarged prostate and you're having trouble peeing, are you one of the guys who does power peeing? You probably know what I mean. You actually push. You're trying to push to pee. And that often tightens up the butt and tightens up the thighs. You do that long enough, you're going to have muscles that stay chronically tight. And that can lead to possibly some pain in that area. And by the way, those muscles attach to the bottom part of the pelvis. So there is literally a connection between your large leg muscles and your pelvic bones. If you are a guy still struggling with incontinence, it probably makes sense why your inner thighs are tight. What muscles are you tightening all the time to try to hold that urine in so it doesn't leak out? Usually it's the butt or the inner thighs. Knowing that, it's actually not very surprising that in addition to needing to strengthen the pelvic floor, you also need to stretch or lengthen a few muscles in the hips and in the inner thighs. So how important do you feel the pelvic floor is now to your ultimate recovery? Thank you for watching this video. Pierre, Bradley, and I were happy to guide you through a self-tour of your pelvic floor anatomy. I hope this helped you connect the dots a lot better to how the pelvis and the pelvic floor are an integral part of your prostate issue, as well as some other structures you may not have thought of that also are an integral part of your recovery. If you're interested in learning more about how you can set up your own self-guided program for the best recovery possible, continue watching our video series on prostate recovery. We would also like to hear from you. We invite you to subscribe to our channel, check the notifications, or give us a thumbs up. That ensures that this information gets out to a lot more guys who need it, and it ensures that you don't miss any further information that could really help you have your best recovery ever.